known to cause infective keratitis. The etiological agents vary from region to region, depending upon the geographical area and depending on the environmental conditions. And according to WHO reports, the infective keratitis causes about 1.5 to 4 million blindness every year. The main objective of my study is to analyze the microbiological profile of bacterial and fungal keratitis in a tertiary eye care center. The study design it was a record-based descriptive study. The study setting was in Regional Institute of Ophthalmology, Trivandrum, and study period was from January 1st to December 31st, 2022. It was 1 year. Then study population, all patients with culture-positive microbial keratitis on corneal scraping. And the sampling method, all patients satisfying the inclusion criteria were included, and the sample size was 295. The inclusion criteria included all the culture-positive microbial keratitis on corneal scraping. The results showed in gender distribution, around 66% of the males were affected and 34% of the females were affected. In age distribution, it was seen more in 41 to 60 years age group. Around 55% was seen in that age category. And in 21 years to 40 years, around 35% was seen. And in less than 20 years, 3%. And above 60 years, 7%. Then the etiology, it showed fungal growth was seen in 81% and bacterial growth in 10% and mixed growth was shown in 9%. And in the distribution of bacterial isolates, the most common bacteria isolated was Pseudomonas. It was around 55%. And then we had Staphylococcal aureus, which was 17%. And then Acinetobacter, which was 7%. And in the distribution of fungal isolates, the most common fungi isolated was Aspergillus. It was around 40%. And then second, we had the Fusarium, which was 27%. And then we had the Penicillium, which was 24%. Now, in my study, the fungal growth was more compared to bacterial, and Aspergillus was the most common fungi and Pseudomonas was the most common bacteria. In Srinivasan et al. Study, which was done in 1995, bacterial was more than fungi, and Fusarium was the most common fungi isolated, and Streptococcus pneumonia was the most common bacteria. In Basik et al. Study, it was fungal more than bacterial. In that, Aspergillus was the most common fungi and Staph aureus was the most common bacteria. And in Thomas et al. Study, fungal was more than bacterial and Fusarium was the most common fungi and Pseudomonas was the most common bacteria. So infective keratitis is still one of the common ocular morbidities that can lead to blindness in developing countries. So the etiological agents vary from region to region. So we need we need to know a proper knowledge of the changing trends in the region, and routine ophthalmological checkup along with microbiological profile of patients present with corneal ulcer is recommended before formulating the treatment protocol. These are my references. Thank you.
So thank you, Dr. Starrell. That was a relevant study because we have a 50-50 review of literature saying a 50-50 between Aspergillus and Fusarium. So when you identify lacunae when you identify research questions, because this is basically a mentoring session. So her research question was a descriptive study, but you should have added why you did this study in the first place, because descriptive studies are generally not considered very attractive as a research question. But here, if you have already got this data that it is 50-50. Yes, so when you present it, the slide should come as the context of your research question should come as we are divided on this. So I think there should be more studies coming up with, which is, it is a 50-50 thing. So we have to have more studies saying which is more prevalent. Is it the Fusarium or is it Aspergillus? So that is the relevance of your study and also the regional differences. So there should have been a slide on why you did this study. Okay. Secondly, where is your materials and methods? That is not at all comprehensive. You must always add the details of how you did the relevant examination. The detail means what exactly did you do? What exactly did the microbiologist do? Was it done by the same person? Were the people with on treatment taken up for the study, or were they not taken up? You can have treatment naive cases. You can have treatment patients on treatment. So all those things should be It should have been more, specific.
Okay, ma'am.
Materials and methods. So because this is a mentoring session, I'm now adding only 2 points because we have a time limit. Okay, thank you.
Thank you, madam.